Today, so in Shepparton, the Greater Shepparton local government area, there's 205 active cases. In the last 24-hour reporting period, we've had 26 new cases reported. 16 of those are linked and 5 are likely to be linked and 7 are still yet to be reviewed. At the moment in GV Health, there is 10 people admitted with COVID-19. 3 of those people are in intensive care and 1 of those people is on a ventilator. So we're getting, still having the same issues in relation to household transmission, and of course, as I've spoken about previously, essentially as soon as one person in the household tests positive, that's very quick and rapid spread from there across to other members of that household. So again, really encouraging people, unless you've got a reason to go to someone else's house that is consistent with the directions that have been issued by the Chief Health Officer, please don't go and visit those people, whether they be a close family member or friend. We're actually probably not that far away in terms of the state government's roadmap where we'll be able to meet people in their own homes, but there are other opportunities, of course, to see people out and about more broadly in the community, of course, within the COVID safe requirements. So we're almost there. So please just stay the course and don't be, as tempting as it is to go and catch up with friends or family, please don't. And as I mentioned earlier in the week, I'd really encourage other people who know where their friends or family members are going to different households when they shouldn't, to ask those people to stop doing that, because that's where we know that it's having the impact in that sense. From a vaccination point of view, we're really quite good now in terms of course, the numbers that were reported earlier in the week in terms of our vaccination numbers. 92 or fairly much 93% of people in the Greater Shepparton area have had their first dose, and 62% or 61%, sorry, have had a second dose. Since we launched the Get the Jab Done campaign last week, we were, of course, the target we were aiming for the people to come forward to be vaccinated that hadn't was 5,000. Really pleasingly today, there's around 2,518 people who we're asking to come forward that still haven't had their first dose vaccination. So that's pretty encouraging to have closed that gap or reduced that gap by close to 50% in the last week or 10 days or so since we first cut those numbers. That's really pleasing. So thank you to those 2,500 people, and certainly would encourage the remaining 2,500 odd people to book their appointment to be vaccinated if they haven't already. So for today and tomorrow at the Macintosh Centre at the Shepparton Showgrounds, we are, in addition to Moderna and AstraZeneca walk-in appointments, we do for today, Friday, and tomorrow, Saturday, have anyone who's seeking a Pfizer vaccine is able to walk in without an appointment to be vaccinated. So all of the vaccines that are available at the state-based hubs today in Shepparton at the Macintosh Centre, people can walk in and be vaccinated without an appointment. Of course, you're still able to make an appointment if at a time that's more convenient for those people who haven't been vaccinated, and also there's access at general practice clinics and also at the community pharmacy networks that are vaccinating now. We're pretty close to closing out the name for the second vaccination bus. So on our Facebook page, the GV Health Facebook page, that is, this week we've been shortlisting and running a competition for the second bus, which will be on the road from next Monday. So thanks again to the Dyson's Group for their work in partnering with us. We know that Jabber the Bus has had a really good response, and it's proven an effective way for us to take vaccination to people that won't, for whatever reason, come to a fixed vaccination site. So the names of the bus that we're narrowed it down to, and you can still vote this afternoon, the shortlisted names are the Vaccine Queen, Gibber, Inspector Morse and Maxine Vaccine. So you can still vote on our Facebook page throughout the course of today. We're closing off the voting towards the end of the day, so say by 4 or 5 o'clock. So if you haven't already voted and you'd like to, please jump on, and then we'll simply be selecting the name of the second bus by the greatest number of votes. So thanks everyone for your contribution, and I'm happy to take questions from here.
Do you have some confidence in that most of the cases are linked now, like, considering the numbers are still pretty high?
Yeah, so it is. It's still that household to household transmission that's of concern. It's allowing us to understand pretty quickly in terms of how it's moving around, but it definitely is, the links are there from people moving household to household. So again, encouraging anyone who knows where people are doing that, that's not consistent with the directions from the Chief Health Officer, to not do that.
So how many of today's cases, or kind of across the last week, just generally have been in new households, and how many of them have been linked to existing households?
So, well, yeah, we need to do some analysis to be able to answer that definitely, but broadly speaking, we are in the order of 100 households now in Shepparton where there's been positive cases during the course of this outbreak. So now there's starting to be people cleared, of course, from they're classified as cleared cases once they're reaching the end of their quarantine period. But in terms of the numbers of people in the household, it's hard to say, because households have different compositions in terms of people that are living there. But yeah, it's a bit difficult to sort of narrow it down in that context. But
yeah, but there's still people testing positive in households that haven't had positive cases, and that's still happening.
Yes, yeah. But in terms of the best way to look at that would be those that are linked and not linked. So pretty quickly that now we're able to establish the linkages in terms of the contact tracing team's work. And as I mentioned, as an example, that the people today that we had, there was 7 that were being reviewed out of the 26 cases. So it's probably more likely than not that the greater majority are linked at this stage, and known acquisitions into those households.
I guess, you know, we've heard for the last few weeks as these numbers have come through that it is household transmission, and it does seem that people still aren't heeding that call. Is there anything else we can do to try to stop this at all?
Well, I think we can, all of the different community leaders and people in different roles across the area, and even into Melbourne, you know, with even right up to the Premier's encouraging people not to do that. I actually think that to some degree the household movement, people are more likely to respond to their friends and families now. My sense is that there's probably a bit of fatigue going through the community in general, that is, in terms of people being perhaps, and a little bit of complacency as well. So as I said before, that's, from my perspective, I think if family members and friends can encourage anyone they know who's moving around that shouldn't be, that's a really good way to help to slow things down. But of course the vaccination's the best way to protect people, to protect yourself and protect other people in the community that you care about from contracting COVID.
And obviously we're coming up to that 70%. Do you feel that people are just going, oh well, we're almost there, what does it matter?
It's a bit hard to say. I think, well, another reflection is that just when I'm, you know, driving to or from work or moving around, you notice that there is a bit more of a lack of compliance with mask wearing, even those simple things, and keeping a distance and sanitising. They're all really important, because it's not any one particular thing that's going to solve this and make COVID go away. COVID's going to be with us for a number of months, if not a good couple more years, really. So we've got to keep doing all of those little things that add up to the end result. So that's the main thing for me, is listen to your family and friends and pay attention to all those small little things, because they do make a difference.
Is there any sign of it slowing down, Matt, case numbers?
I don't think, you know, based on our numbers that we've seen this week being in the 20s and then 30 the day before, so 30 in terms of Wednesday's numbers, I think it's probably going to be in the 20s. Tomorrow I expect the numbers will again be in the 20s, so probably we can expect over the weekend and into the early part of next week, case numbers, new cases, to be in the 20s and if not into the teens. I would really like that it does start to taper, but we've just got to keep doing some of all of those parts so that the numbers do come down.